And I've written letters of recommendation for staff that I personally didn't particularly like, and they've worked for me for more than 10 years. I don't have to like you to say that you met or exceeded your job description's expectations, you are completely ethical and very moral. In other words, I just wrote something very similar to this for, we had to change organizationally on how we were handling data analytics functions at my company. And Gil's assistant director revamped that program, and we changed the position so 2 people actually who had more than 10 years with my company, their positions were eliminated because we wanted to do it in the corporate office and they worked from home. And I wrote 2 letters of recommendation for them because, and I particularly don't like either of them. I mean, you know, personally, would I spend time with them? No, you know, I'm being honest. But that doesn't mean that just because I don't want to go watch football with them doesn't mean that I don't think that they were outstanding employees, did their job. They chose not the option to come work at the corporate office. And that's a big thing, because you'll find as companies and hospitals and healthcare organizations change, one leader will say, I think we're going to decentralize everything and move everybody home. And you'll have the next person come in and say, I want to centralize everything and do everything at corporate. And Alex, Gil's assistant director, decided it was time to centralize the data analytics function within our headquarters. And those 2 people were no longer necessary. But my point is, do I think they have excellent character? Yes. They wouldn't have stayed so long at my company. But it's not like I didn't. I just didn't have much in common with them, and I didn't really like them, you know? But it's okay, because you don't have to like everybody. If all of you reported to me, I'm sure I personally wouldn't like a couple of you, if that's okay. But that doesn't mean if I don't like you that you shouldn't get promoted, you shouldn't get raises. If you're meeting or exceeding your expectations of your position, right? And you do a good job, just because I don't like, you know, I don't know, you wear green shoes, or, you know, you have these bright, you know, orange, I'm looking around to make sure nobody has bright orange glasses on. Like, you wear bright orange glasses and I don't like them. It's meaningless. It's meaningless. Trust. The 2 people that I did not like, I trusted them to do their job well. I did. And again, you don't have to like everybody. It's life. So did anybody see this movie, Horrible Bosses? It was 1 and 2, Kevin Spacey. I think I've been a psycho. And there's medication that I keep in the car for that. But you just gotta, we're gonna go into some real key pointers how not to do this. Now I'm looking around this room and I'm not sure, but I think the only person in this room that follows me besides my 3 employees here is, sorry, Rachel, I think you follow me on LinkedIn. Did you see that I did a post about a month ago about 8 steps to avoid being a horrible boss?
No, I didn't see that.
No, see? Because I checked today to see who is coming that follows me to see if they would know. You probably forgot anyway.
I will go look it up.
Oh, I'm going to give the presentation now. No worries. So I'm giving the credit here. I can't say the guy's name or her name, DG Aking Bade, but I subscribe to Lifehack, and sometimes I get some stuff in my email. I don't have time to read them all, but I happen to read this information, and there's 8 steps I'm going to go over to what inspires you to be a good leader, and I thought that they very much impacted health information management, and this was never going to be part of this presentation. And I thought, what else can I add to it? And this is something I posted, you know, on Health Information Alliance LinkedIn. So, ruling with an iron fist. How many people in this room think you have a boss at your full-time job, part-time job, whatever, that rules with an iron fist? Gil, I will cut that fist off. And what's the ICD-10 code for employee cuts off the wrist? That was his right hand, by the way. Those days are gone. But the big thing we have to do is inspire. And this isn't a cliche, and I'm not being cute. Well, I'm not cute anyway. But it's just like Fire Day, to inspire people. When you're a leader in HIM, you need to inspire the folks around you. So I have a question. How many generations right now do you think are in the workforce? 4? 3?
More
There's
than
actually 5. There's actually 5 in the workforce right now. So you need to be able to address those people. Okay, John went to get the Christmas cards for the company made at Walmart. Gil and I are waiting, and we see a Walmart associate who was definitely an octogenarian, you know, this older man. And do you remember the guy, Gil, I'm talking about? He was getting like the little round things and giving to the lady who was like in her 70s, you know what I'm talking? And you said, wow, you know. Well, you have to deal with people in their 80s because they're still active and they're out there. And then you may have, you know, 16-year-olds. You can hit all those generations. I was at my, I don't know what reunion from high school, and I'm standing next to my friend Kathy Bell, and she's a scientist at, I don't know, one pharmaceuticals, and she was pregnant with her first child. And they were giving out awards to these 2 girls that were the 2 first grandmothers. And Kathy says, how can they be grandmothers? They're so, you know, she said, I'm pregnant with my first child. And I'm like, Kathy, you're a scientist, you're smart, you were in one of my classes. Let me tell you, 16 and 16 are 32. Inchworm, you know. I mean, they could be grandmoms, 16 and 16 is 32. So what I'm saying, there's 5 generations out there that we need to deal with. So it's not managing people and commodities with an iron fist. You have to be open. You have to be able to manage people of every single color, people of every single religion. America is a huge melting pot. It's hysterical. And your clients, not just being a leader for your staff, but your clients, whether you're in HIM, at an acute care hospital or an ambulatory facility, and your clients are the people walking in the door. But if you're in an HIM department in a hospital, your clients are all the other departments. Your clients aren't just the people coming and looking for their records. Your clients are the performance improvement department, the ambulatory surgery department. Anybody that wants information, they're your clients. So you need to accept and work with and be cognizant of everyone. No filters. So it's key. So we're going to go through these 8 steps. Step 1 is to allow freedom of action and independence. You cannot micromanage people. I am an overbearing, meanie, horrible boss. And Gil did a contract today, and he said, can you proof it? I said, did you read it twice? Why don't you print it out and get a ruler and go through it line by line? And he said, I already read it twice. I'm picking on you, Gil, but this is what happened today in the office. And he said, sit down and read it. So I sat down, and the first thing I noted was on page 2, the header, the date wasn't changed. So he changed the date on page 1 of the contract, but that doesn't automatically change it on page 2. So that was just, it's a careless mistake, and I have done it. What I'm saying is I have to have somebody else read my stuff like Gil did. It's not that it was careless. He's focused on the body of the contract. Is he focused on, he changed the date once. I've made the same mistake myself. And on page 2, it has a different date because the header will repeat itself in Word. So I shouldn't micromanage him. I asked Gil to take care of that contract, and he normally doesn't. His assistant director does. And Alex was swamped today because we have somebody out. So Gil did something that he normally doesn't do, and I empowered him to do it, and he just asked me to check it before it goes out to see if there was a silly mistake. He didn't make any mistakes to the contract. It was just a silly mistake that the date was wrong on page 2 through 19. So don't micromanage people. If you want to be a good leader, give everybody room. If you trust the people that you manage, they will trust you. It creates a very positive work environment. I trust the people that work for me to get their job done. John does all our recruitment. John handles a lot of different things, and his work wife happens to be out on leave of absence. So John has doubled down. He has 10 o'clock nights at the office. We go to John, his bosses, and say, is there any way we can help you? What can we do for you? Because we know you're carrying a portion, big part of the load of almost 2 positions. How can we help you? We're not telling him to stay till, 10 o'clock at night, and Gil and I say, it's 5 o'clock, we're headed to happy hour, see it. Wouldn't want to be it. I mean, that's, not what we're doing. So, see your employees for who they are, not what they are. And we talked about a little bit about this, like file clerk, coder, receptionist, birth certificate lady, just yelling out. I have this friend, her name is Nicole Anderson, and this is a story I put on here to remind you. So Nicole works at Presbyterian Medical Center, which is now Penn Presbyterian University Hospital. But Presbyterian Medical Center was an inner city hospital in Philadelphia that was a community hospital, and the neighborhood was poor at the time. And my company was in there. I used to sign out medical records because we were always a remote company. So we would come in and box them, sign them out and box them, stick them in boxes, and deliver them to our staff that worked at home. Everybody carried a pager, and we had to have them back to the hospital within an hour if the patient got readmitted, and everybody that worked for me had to have a fax machine. So Nicole used to pull the records for me in the basement of Penn Presbyterian, which had roaches and rats, okay? And Nicole was a new hire clerk, but this woman is smart. And I saw managers, I've been at that hospital since the inception of my company, maybe a few months after my company started. I think they were my second client, and it's still one of my biggest clients. Hi. So anyway, Nicole, what she's done is there were a couple directors that blew through that department and said, oh, she's just a file clerk. Well, I'd stay in touch with Nicole because you know what? She's an intelligent file clerk, and she learned when the first EHMR, I call it, electronic health record, or when the EHR was installed, when the first computers came down to that department. They didn't even have computers when I started. It was 92. Nicole, she's smart. She learned. Do you know she's not in the basement anymore? She's at like 1818 Market Street in a high-rise that's like Fort Knox, and she's a big manager now, and she's somebody that came from no money, no education. She went back and got her RHIT that the hospital paid for, but I saw directors briefly there. They had a lot of turnover. Oh, she's just a file clerk. Nicole, do this. Nicole, do that. And Nicole would mutter under her breath. But then I would be in meetings, and people in administration in that hospital like, I'm not sure how to get this done. And I'd be like, really? I need to pick up the phone and call Nicole Anderson because Nicole knows how to do that. I still go to her to get access to certain systems with different people because she knows who to contact. So respect that person. Nicole was a leader. When she was treated like crap by various directors, she didn't blossom into the person that she blossomed into. And the first director that I think really, really liked her, another friend of mine, Shiny George, I said to Shiny, she's an asset of information. She's an asset. Bring her in your office and talk to her today. Find out what she knows. Because a lot of times when a new director takes over a department, they bring in each employee and they ask them questions. And to learn what their perspective is and what they do and what's going on. And I just wanted to see this girl shine, and let me tell you, she shines now. So let go of the job titles, let go of who they are, let go of where they came from, just let it all go and learn what you can, because that person has something to say. I'm emphatic about that. Don't show favoritism. Okay, tardiness example. When Gil worked in the Pennsylvania office at corporate, Gil, this is my example, I'm calling him out. He had the worst traffic. There was no direct way to go from his home. It was down by the river in that part of the city. There was no highway, no expressway, no turnpike. There was no, he had to take all ridiculous roads to get to the office. But if you're doing it at 8:30, you're doing it at 8:30. And Gil, I mean, do I like Gil? Yeah. Am I friends with Gil? Yeah. I'm friends with John, too. You know, I'm friends with Alex. No favoritism. But we have another manager, Lisa Flanagan. And I grew up with Lisa. I've known her since I'm 5. But if you have to be in at 8:30, you have to be in at 8:30. You know, now, if you're not going to be in at 8:30 because there's an overturned tractor trailer, you know, you can't get in, then you're expected to text your supervisor. There's understanding to that. But you need to be at 8:30 like most of the time. So if you know on average it's going to take you, he was in it, maybe how many minutes were you away with no traffic? You know,
About 50 minutes.
50 minutes? And there were days it would take you what?
Hour
Right. Horrible. So, you treat everybody the same, even if you're friendly with somebody. Even if I only like girls that wear red shirts, and you're going to be my favorite, even if she's my favorite, and we like the same, I don't know, we both like the Pittsburgh Steelers, and we both like the Marlins, I don't know. And we have so much in common, and you're just like, I hate the Philadelphia Eagles. Okay? So we don't like you because of that, it's just sports. Really, can we just grow together professionally and move forward so we can optimize what we're doing? And if we optimize what we're doing, there's growth in it for all of us. Lead by example. I want to talk about my friend Lynn Rusleys. So Lynn's retired now, but at one point, she was my client, and she ended up working for my company as a manager for a few years before she retired. Lynn's management style as an HIM director was Lynn could do every single job in that department. I don't care if it was answering the phone as a receptionist. I don't care if it was the tumor registrar. I don't care if it was coding. I don't care if it was completion. Every function in that department. And how Lynn's management style was every day she'd walk over to each person's desk and sit down next to them and start doing their job with them and talk to them. Isn't that cool? And it was really cool because she would work right next to you and say, how's your day going, what's going on? And if somebody called out and they weren't there that day, Lynn went and did their job and managed from that person's desk in the department. Her department loved her. And when she left that hospital and ended up working for me, she managed, in the Florida offices at the time we had, 12, 13 people all working on HEDIS studies. And they were working at terminals where they're on the phone, they're on the computer, and there's fax machines then because there wasn't, records were paper, and they're faxing them in and entering in these clinical studies. And Lynn when she went into the office, she would sit next to each person and help them during after that. And then she'd pop into my office and say, Sally's probably going to go home sick today. Betty's got this big doctor's office thing that's going on. And so I helped Betty, and I'm going to sit in Sally's desk, and she leaves. Like, that is somebody, the staff loved Lynn, And if they love Lynn, and they know they can count on Lynn, and they can trust Lynn, and Lynn leads by example, then they'll respond in turn. So, this is a nice saying. Don't delegate, participate. And I learned this from somebody that's retired, so some old school stuff is still good, Listen to your employees. Now, I saw this ear over here, so I'm going to pick it up, and I want you to walk away with one thing. Remember, Lou, hold me ear, okay? Listen to your employees. This is very, very important to listen to, because if you don't listen to your employees and you think you're having delusions of grandeur in your head, that you think the new EHR that you implemented is working fine, or you think the new vacation policy that you implemented is working fine, you need to listen. So I have an example here. Prior to starting Health Information Alliance, which was 23 years ago, I worked for a company called SASTEC International in an HIM role. Worked there for 7 years. The original CEO and founder of SASTEC, before they went public, his name was Tom Reed. I loved and respected this man. He didn't even have a high school diploma, let alone a college degree. He had a GED, and it was a major international corporation. Tom, they had offices in Kansas City, Missouri. And Tom was in that office working with management, and they had a loading dock where different types of healthcare information would be brought by truck and entered. I know this is a million years, like 30 years ago, so tell me a break. So one day, Tom went down and spoke to the guy on the loading dock. And he asked his perspective. This is the guy that runs the loading dock, right? And he's the CEO of this international corporation. And asked him in Kansas City some of his input and feedback. And then Tom came back to the board and said, we're going to institute some changes. And the board was like, well, where'd you get your research? What did you do? He said, well, I talked to like Joe down on the loading dock. Everybody thought he was crazy, but I learned from that. Because Joe in the loading dock sees a perspective on how more efficiencies can be gained because he's in the loading dock. So you might have a release of information person that sits next to the person that's the receptionist in the acute care department, right? Talk to them. They're the ones answering the phone all day because when Sally gets up to go to the bathroom, the release person is answering her phone. How can we make that better? How can we make it jive? What increases in efficiency can we achieve by listening to all levels of employees, not just a bunch of blowhards up in the C-suite?